Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist. To define the trigger point, it'll feel like a palpable band. It may feel like a small nodule. Usually it refers pain. So you don't have to use a lot of pressure to find a trigger point. So she has low back pain in this region and stiffness. So I'm going to just moderate pressure, glide with my thumb, and see if I feel anything that feels a little suspicious. Okay, now I just went over two things there that I think are suspicious, but I'm going to continue to see if I find other areas. And when I say feel suspicious, meaning as I glide along here, this has a certain quality, and right there feels just a little thicker, a little tighter, a little bit, and it may or may not be an active trigger point, but we'll check in. At that pressure, was there any discomfort there? Mm-hmm. Okay, there was. Okay, so first important principle of neuromuscular therapy is you do not need intense or strong pressure to find trigger points. You want to find them at light to moderate pressure. And if you're not sure, like I said, when I say I feel something that feels a little suspicious, gee, it feels a little tight, let me check in with the patient. Don't just assume. So she said, yeah, that's a little uncomfortable. Now, the next most important thing about actually treating the trigger point with ischemic compression, or as Kellogg would say, pressure touch, is sink into it slowly and communicate with the patient. So, Amanda, I want you to tell me when, as I press down, we reach a point of mild to moderate discomfort. No more than what we might say is like a good hurt, or another way to describe it is on a scale of 0 to 10, 0 being no pain, 10 being severe pain, stop me when I'm around a 4 or 5. Okay? So you're in control of the pressure. So you tell me when to stop. So I'm slowly sinking in.
Right about there.
Okay. So she told me when to stop. So if you let the client determine the pressure, you have a very low chance of injuring them. They told you. Now, once I've gotten to that point and I'm holding it, we're usually going to give it about 10 to 15 seconds. And you may or may not feel it changing. You may feel it softening or easing a little bit. Amanda, do you feel that changing at all?
Mm-hmm.
Okay, so it's feeling like it's easing off a little? Mm-hmm. Great. So this is an important thing to convey to the client. I did not change my pressure. The muscle relaxed under the pressure. If, and sometimes this happens, you press, they say stop, and after 10 or 15 seconds, you check in and say, did that ease? And they say no. That means it was too much pressure. So even though they were comfortable with it, their muscle could not respond to it. Because what we want the muscle to do is relax. So if it didn't change, it didn't relax, it didn't respond appropriately. So unfortunately, a lot of people, when they think trigger point therapy or neuromuscular therapy, they think find a trigger point, apply a lot of pressure to it, hold it for 10 to 15 seconds, and you're done. But if it didn't relax or if the person tightened up against the pressure, you actually had a counterproductive effect. You were trying to get the muscle to relax, and all they did was splint or tighten up against the pressure. That's not good therapy. The reason I make this point is I see it done so often that way. Well-intentioned therapists, but somehow they didn't grasp the subtlety of this and the communication. So, now that I've done that, there was another spot, and I want to check in with that also. It was a little further down, like right there. And again, that's moderate pressure, and you will get better at feeling these subtle changes. Don't worry about it right now if you can't distinguish. So is there a little discomfort here also? Okay. So same thing. And another really important thing is when you find the trigger point, don't just pounce on it. Sink into it slowly and gently, and again, communicate. So again, you tell me when to stop, just at that mild to moderate discomfort zone. So that's really not even a lot of pressure. It's actually easier for you as the therapist because my tendency would be to use more pressure here. But she's told me to stop there, and that's where I stop. And as I hold that, does it feel like it's changing a little bit? Mm-hmm. Great. So we've done 2 trigger points with pressure touch or ischemic compression or trigger point therapy. They all mean the same thing. Now that we've done those 2 individual points, we want to glide with the thumb with moderate pressure to just lengthen and stretch out all of those fibers. And I could feel her tighten up against that pressure as I went through there, because that was sore, right? Mm-hmm. Okay, so there was just this subtle thing. So as you're gliding, if you feel the muscle tighten up, that means it was actually too much pressure. Now, I wasn't using a lot of pressure, but it was too much for that muscle because I felt it tighten up. So you don't want the muscle to tighten up at this point. So you back off the pressure a little bit. You just always go with the best you can. But then this helps to lengthen and stretch out the fibers. This should be in the moderately firm zone. And on the low back like this, I would do it in both directions. And I'm just supporting the tissue down here so I don't just move the skin. Also notice on those 2 areas where I treated the trigger point and have done this friction, that notice the difference in how much blood is here versus how much blood is on the untreated side. It's a huge difference. And that was just 2 little trigger points and a little moderate level friction. That's an effective way to treat trigger points. Now, as a general guideline, I would never treat more than 2 or 3 trigger points before doing some general relaxation strokes. This gives a person the opportunity to relax and integrate, because this can be really intense. If you just go, oftentimes how trigger point therapy is taught is just trigger point to 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 trigger, and people start to feel pretty beat up. In fact, when I first learned neuromuscular therapy and I was doing it as I was taught, people would often get off the table and say, boy, I feel like I fell off a horse, or I feel like I've been beat up. And so I just kind of observed that and said, well, that's how it's always been done on me, but maybe this is not the best option. Maybe treating a couple trigger points and then doing some nice general relaxing massage strokes, doing a little general friction, some general kneading. And of course, you should always warm up the area first anyhow. So you're just going back to doing these kinds of things and then go in and treat a couple more trigger points. So a good, no pun intended, rule of thumb is treat 2 or 3 trigger points and then do some general relaxation strokes. If there's more, treat 2 or 3 trigger points and treat some general relaxation strokes. And that could easily be done. Like on the back, there might be 10 or 15 trigger points that need treated here. And if you don't give the person a little rest, it can be a little overwhelming.